Hello, everyone. Welcome to today's pre-recorded presentation by the Department of Healthcare Services regarding Medi-Cal's longstanding behavioral health treatment, or BHT benefit, as well as the new option for obtaining BHT services as of July 1, 2025. Ultimately, this new option was created to help promote and ensure access for these critical services for all eligible Medi-Cal fee-for-service members. Next slide, please. So I am Erica Holmes, and I am the Assistant Deputy Director over Healthcare Benefits and Eligibility. One of the divisions within my portfolio is the Benefits Division, which is responsible for developing, implementing, and overseeing Medi-Cal medical coverage policy for most healthcare services provided by California's federal Medicaid program, which you all know as Medi-Cal. And this includes BHT services. Next slide, please. So for today's presentation, we have a lot of material to cover, including some background about the BHT benefit as it exists today or pre-July 1, 2025, what the pathways for accessing the benefit will look like going forward, what provider types can provide BHT services, how the new Qualified Autism Services or QAS provider enrollment process will work, as well as the associated requirements for that provider type, and an overview of coverage and billing policy. Next slide, please. So foundationally, I first want to quickly provide some context around how the BHT benefit exists today in Medi-Cal. Next slide, please. So, circa 2018, the Federal Centers for Medicare and Medicaid Services, or CMS, issued guidance that state Medicaid programs needed to cover BHT services for children under the age of 21 according to the requirements under the Early and Periodic Screening, Diagnostic, and Treatment, or EPSDT benefit, which I will address in more detail a bit later in today's presentation. CMS originally required that BHT services only be provided for children with autism spectrum disorder diagnoses, or ASD. But in 2018, they clarified that under EPSDT, state Medicaid programs such as Medi-Cal were also required to provide BHT services for any children under the age of 21 for whom those services were recommended by a licensed provider as medically necessary. Next slide, please. So BHT services include a variety of behavioral health interventions, but primarily they include what's called applied behavioral analysis, or ABA services. Well, I won't read all of the different services on this slide to you. You can find a non-exhaustive list here. I do want to note that California law, which is outlined in Health and Safety Code section 1374.73, requires that BHT services are either prescribed by a physician or developed by a psychologist. Under Medi-Cal policy, the physician or the psychologist determines that BHT services are medically necessary for the child and then recommends them to a qualified autism service or QAS provider to receive those BHT services. Next slide, please. So in addition to being medically necessary, under Medi-Cal policy and consistent with applicable state law, Medi-Cal also requires that an appropriate provider develop the treatment plan and that services may be provided by any of the QAS providers who are listed here on this slide. Here I also want to note that the requirements for each provider type are outlined in the Medicaid state plan, as well as the new BHT section of the Medi-Cal provider manual, which is now live on our website. Next slide, please. So all Medi-Cal covered services must meet a threshold standard called medical necessity for coverage and reimbursement under our program. This is a hallmark of any Medicaid program. Federal and state law define medical necessity under EPSDT as a service that will correct or ameliorate a condition, which I would note is a much more generous standard than the definition of medical necessity for adults, and ultimately helps to promote increased access to services for children under the age of 21. In Medicaid, the intent is to provide services and interventions to children to identify and treat issues as early as possible, with the goal of mitigating the impacts on their lives and increasing their chances of success into adulthood. Another hallmark of medical necessity, and particularly important in the BHT context, is that all medically necessary medical necessity determinations are individualized and they must be made on a case-by-case basis for each individual Medi-Cal eligible child. Next slide, please. So I won't read the slide to you in its entirety. The important thing here to note on this slide is that it expands upon what I just previously shared about the EPSDT medical necessity standard. And what I would highlight is that most significantly, this standard allows for the provision of services that make a child's condition more tolerable, as well as services that maintain a condition, not just those services that improve it. Next slide, please. I also want to note that at a high level, there are instances where Medi-Cal will not cover certain things as BHT services. And again, there's examples on the slide, but those include things such as services that do not have an expected clinical benefit or that are not evidence-based. And it also includes provision or coordination of respite, daycare, recreational services, or educational services. It also includes custodial care and so forth. The theme with many of these services is that they would fall below that medical necessity standard we just discussed, and or they would fall outside the scope of Medicaid program coverage more generally. For now, it's kind of important to emphasize that in Medi-Cal, the child's participation cannot be conditioned on the parents' participation, although we certainly recognize the value add of parent participation in the success of the child, and particularly that's true when it comes to BHT services. Next slide, please. So now I'd like to sort of shift our focus and talk a bit about the pathways for accessing BHT services in Medi-Cal fee-for-service. Next slide, please. So first, we're going to talk a little bit about the local regional center pathway, which is the existing primary option available today for Medi-Cal fee-for-service children who are seeking BHT services. Next slide, please. So as I alluded to earlier on in the presentation, the department has developed another option for Medi-Cal fee-for-service members who are seeking BHT services, which we will dive into now. So as you likely know, regional centers have provided BHT services to California's children for many, many years, and originally provided them to children with Medi-Cal under a federal waiver authority from CMS. When CMS required states to cover BHT as a mandatory Medicaid benefit, children who receive services through the managed care delivery system transitioned their BHT services to their assigned Medi-Cal managed care plan, or MCPs. And the department developed a contract or an interagency agreement with the Department of Developmental Services, or DDS, to provide BHT services at local regional centers across the state for Medi-Cal children who have fee-for-service. Board certified behavioral analysts, or BCBAs as they're known, are going to be able to provide these services now directly to Medi-Cal children as a new provider type, which is called the Qualified Autism Service, or QAS Provider. And this is effective July 1st and ongoing. These new providers will be able to render BHT services to children with Medi-Cal fee-for-service as an alternative option to children receiving their BHT services only from their local regional centers, as was the status quo pre-July 1st. Pursuant to state law, it's also important to highlight that local regional centers are limited to providing services to children who meet certain additional regional center eligibility criteria, which some Medi-Cal fee-for-service children have not or may not have been historically able to meet. And so the department is now enrolling this new QAS provider type and providing this additional option to promote and ensure access to this critical BHT benefit. Next slide, please. So as I already mentioned, one pathway is that a Medi-Cal fee-for-service child can go to their local regional center for an evaluation. Their physician or psychologist would then determine if that child met regional center eligibility criteria, and then that child would be able to then receive BHT services directly from their local regional center. This is what happens today, and this will continue to be an option going forward for our Medi-Cal fee-for-service population. And the department will continue to pay for these services through our contract or that interagency agreement with the Department of Developmental Services that I mentioned earlier. Next slide, please. So as I mentioned, local regional centers have their own additional eligibility criteria under state statute. At a high level, provisional eligibility applies to Medi-Cal members who are up to 4 years of age, and they may qualify for and receive BHT from their local regional center without a diagnosis of developmental disability, as specified in state statute. You'll find additional information regarding provisional eligibility on this side. And this is just kind of being provided as context for why the department felt it was important to also create this alternative access pathway for BHT services. Next slide, please. So when it comes to regional center eligibility, let me first caveat that neither myself nor the department, more generally, are experts. And so we would defer ultimately to our colleagues at the Department of Developmental Services for more granular eligibility discussions and to answer sort of more nuanced questions in this space. That said, eligibility criteria for regional center services, as I mentioned, they're outlined in state statute. And then children who do not meet the criteria for provisional eligibility, as we just discussed, would then need to have a qualifying condition to receive BHT services from their local regional center. Qualifying conditions are similarly outlined in state statute, and they include things such as intellectual disability, cerebral palsy, epilepsy, autism, etc. Assuming a child is deemed eligible for regional center services, which would include BHT services, they would be assigned a case manager or a service coordinator to help develop a plan, and then that individual would assist with accessing services. Next slide, please. So with that sort of background in mind about the current state, I would like to now shift and talk about the main focus for today's presentation, which is the new Medi-Cal fee-for-service provider pathway for accessing BHT services. Next slide, please. So as I mentioned, this is a new pathway which will be effective on July 1st of this year. This pathway will be an alternative option to the regional center pathway that we just spoke about in some detail. And by creating an enrollment pathway for this new qualified autism service provider type, or QAS provider type, and activating billing codes, enrolled BCBAs will be able to render and bill for services provided to any child with Medi-Cal fee-for-service who qualifies for BHT services under Medi-Cal's current policy, which again is consistent with that broader EPSDT medical necessity standard that we spoke about earlier. Next slide, please. So if a parent or any provider believes that a child would benefit from BHT services, they should ultimately talk to the child's doctor or a psychologist to determine if they qualify for services. If the child is determined to be eligible, their doctor would then recommend BHT services and connect the child with a Medi-Cal enrolled QAS provider. The department is planning to maintain a list of enrolled QAS providers that would help parents and guardians then connect the child with a QAS provider for BHT services. We also expect to share this list with advocates and other organizations throughout the state who help to assist parents with accessing BHT services for their children. Next slide, please. The department has been working in close partnership with our colleagues at the Department of Developmental Services to develop guidance to provide to all regional centers on how to help parents and guardians whose children do not meet regional center eligibility criteria to nevertheless be connected with enrolled QAS providers for BHT services. This guidance is very close to being finalized and is intended to function as a type of sort of no wrong door approach, if you will, to help reduce barriers and promote access to BHT services. Parents may choose to go to their child's doctor or psychologist first for an evaluation for BHT services, but regional centers also provide additional services for children, so there may be some advantages to still being evaluated by regional centers for services that they provide. Next slide, please. So now that we've discussed this new enrollment pathway, I want to shift to talk about the Medi-Cal fee-for-service provider types and those enrollment requirements more specifically. The qualifications for all three provider types are listed in the Medi-Cal provider manual as well as the state plan, and that would be supplement 6 to attachment 3.1a. None of the practitioners on the following slides need to be regional center vendors, so I just wanted to make that clarification. Next slide, please. So first, let's talk about the Medi-Cal provider types that can provide BHT services. Next slide, please. So Medi-Cal recognizes that all of the provider types that are listed on the slide as qualified providers of BHT services. We have added a link to their description of the qualifications that are in the state plan for your convenience. Um, just want to note that because many of these provider types are already enrolled in Medi-Cal today and provide other services and supports, only BCBAs and educational psychologists will actually need to enroll as the newly established QAS provider type. So to reiterate, licensed providers who are currently enrolled in the Medi-Cal program and provide services today do not need to take any action to bill for BHT services on or after July 1st of this year. The department has taken proactive approach to program the system to allow for existing licensed providers to be able to bill for the BHT billing codes, which I will provide more information on later in the presentation. Next slide, please. So a couple of key things on this slide. So first and foremost, QAS professionals are not going to need to enroll in Medi-Cal because they are supervised by a QAS provider who enrolls in the program and ultimately bills on their behalf. As you may notice, the department has also added associate providers as those who may render BHT services. Additionally, QAS professionals are now able to supervise QAS paraprofessionals under Medi-Cal policy for BHT services. Qualifications for QAS professionals are listed in the provider manual as well as the state plan. And also please note here that QAS professionals do not need to be regional center vendors. Next slide, please. So under Medi-Cal policy, the qualifications for QAS paraprofessionals remain the same, although they now may be supervised by either a QAS provider or a QAS professional, as I just noted. Next slide, please. So with this information about providers in mind, I want to shift quickly and talk about the enrollment requirements and processes. Next slide, please. So as I mentioned, licensed providers can now render and bill for BHT services as of July 1st. Additionally, the department is now allowing two new provider types to do so as well. This includes the QAS provider individuals, such as BCBAs or educational psychologists. It's also going to include QAS provider organizations, which are for-profit groups or organizations that provide BHT services. The department is also modifying our existing community-based organization or CBO policy to allow CBOs to be able to bill for BHT services provided to eligible Medi-Cal members. Here it's important to note that due to federal requirements, even QAS providers who are only providing services to Medi-Cal members enrolled in managed care and receiving services through their managed care plans, those providers will still need to enroll now that there is a state-level enrollment pathway. However, the department wants to emphasize that enrolling does not obligate BCBAs to then provide services to Medi-Cal fee-for-service members if they're only serving Medi-Cal managed care members. Although the department sincerely hopes that many of our BCBA providers would consider now also accepting Medi-Cal fee-for-service members in the future to help promote access to this very important benefit. Additionally, it's important to note that enrolling in through our provider enrollment system, it doesn't have any impact on the treatment plans that are currently authorized, as that's a separate process from provider enrollment. Further, just want to note that the department plans to afford Medi-Cal managed care plans a grace period of at least several months to allow their QAS providers to submit the enrollment applications and be approved by the department. I also would like to note that QAS providers will need to report an established place of business as part of their application. To this end, I just want to acknowledge the department recently learned that some BCBAs work out of their home or they don't otherwise have an office. So we are working on some policy to make an exception for individual BCBAs to the established place of business requirements. More information will be released about this exception very soon, but the department expects this to take about 6 months due to the required regulatory processes. In addition, also just want to note that CBOs that wish to provide BHT services, as I mentioned, they will also need to submit a supplemental provider enrollment application so that way we can add the appropriate billing codes for them. Next slide, please. So the department began accepting QAS provider enrollment applications in advance of the July 1st start date to give us a runway to have a sufficient pool of providers enrolled. So we actually started that back on May 5th of this year. The department strongly encourages any QAS providers to get their applications into the queue for review and approval as soon as possible, as it can take some time for those to work their way through the process. Just as a flag for QAS providers whose application was approved on or before July 1st, they will be able to start and bill for services as of that date. For providers who submit an application after June 30th, you'll be able to bill for services provided starting with the date that you submitted your application. And that assuming the application is ultimately approved by the department. CBOs that have already enrolled will be able to add, as I mentioned, the BHT services as a new category of service by submitting a supplemental application to the department. You can find applications on the DHCS website through the online enrollment portal. Next slide, please. So a couple other important things I just want to highlight about Medi-Cal provider enrollment. First, to reiterate, licensed providers who are already enrolled in our program do not need to submit a supplemental application or take any action to be able to bill for BHT services on or after July 1st. If you will be submitting claims for providers other than yourself, you will need to attest that everyone meets the qualifications that are listed in the state plan and our Medi-Cal policy, and that were also outlined in this presentation in some detail. QAS providers, provider organizations will not enroll as groups, but as a healthcare business, which is an option that you can find when you go into the provider enrollment portal. Next slide, please. Again, as a reminder, QAS providers who render services exclusively to Medi-Cal members in managed care who receive services through managed care plans still need to enroll through the Medi-Cal provider enrollment system. This requirement applies to QAS providers who are already contracted with Medi-Cal managed care plans. And again, we plan to afford Medi-Cal managed care plans a grace period of at least several months to allow sufficient time for them to enroll their QAS providers. And for those applications to be approved by the department. Individual QAS providers who are currently required to report an established place of business where they see their clients. And again, in recognition that many of these individuals work out of their home or do not otherwise have a business location, we are since this address will be made public, we are also temporarily exempting individuals who are contracted with a managed care plan and do not have a business location from enrolling. I want to highlight here that this temporary exemption does not apply to fee-for-service, since providers must be enrolled in order to bill DHCS directly. And we plan to also revise enrollment requirements later this year to exempt individual BCPAs from the established place of business requirements, as I had mentioned earlier. Next slide, please. So on this slide, you will see a list of information that will be required as part of your Medi-Cal provider enrollment application. Please take all efforts to ensure that you're completing all aspects of your application. Please also note that if you provide services at more than one location, each location does not need to enroll separately. Please also note that any address used in the application is reported publicly, as I mentioned, which means you can find it on our open data portal, which is why we made the exception as discussed on the previous slide. Next slide, please. So on this slide, you'll see some additional provider enrollment requirements, which are a continuation from the information on the last slide. I won't read them to you, but this is information that is required as part of your Medi-Cal provider enrollment application. Next slide, please. So just to reiterate, as I mentioned, CBOs can provide BHT services. So CBOs Again, I want to highlight CBOs must be a nonprofit 501c3 entity. For-profit CBOs are not able to enroll in our program at this time. CBOs, again, that are already enrolled will need to submit a supplemental application to allow them to bill for BHT services. Next slide, please. So now I want to shift our focus to Medi-Cal BHT coverage and billing policy. Next slide, please. So first, we'll focus on the coverage aspect of the policy. Next slide, please. So I'm happy to report that the department published a new dedicated section of the provider manual for BHT services. This will be effective for dates of service on or after July 1st. The provider manual describes in detail the policy, billing codes, and many other items of interest that were also included in today's presentation. Next slide, please. So now I want to pivot and share a little bit of information about the status of Medi-Cal fee-for-service reimbursement rate development, which I know is of great interest to our provider community. Next slide, please. So at a high level, my colleagues in the healthcare financing area are considering several different data sources in looking to develop the Medi-Cal fee-for-service reimbursement rates for BHT services. These include things such as the rates paid to the managed care plans, as well as the rate structure utilized by our local regional centers, among other sources of data. Next slide, please. So, as part of the rates development process, the department plans to publish a public notice, which will go out before June 30th of this year to preserve the July 1st effective date. This will go through the state plan amendment or the SPA process to our federal partners at CMS for final review and approval. We plan to submit the state plan amendment no later than September 30th of this year. All rates will be retroactively effective back to July 1st, which is the date that the providers can begin providing services to Medi-Cal fee-for-service members through this new pathway. And I want to highlight here that all of the rates, again, will be retroactively effective. And once finalized, the final Medi-Cal fee-for-service reimbursement rates will be posted on the DHCS website, on the rates page, as well as on the BHT website, our BHT website. Next slide, please. So until the final Medi-Cal fee-for-service reimbursement rates are established and programmed into our system, QAS providers and CBOs are going to be paid by report. This means that providers will be able to be reimbursed prior to final rates being established. Reimbursement by report requires that providers submit cost documentation to the department with their claims for reimbursement in order for our fiscal intermediary to manually price those claims for payments. The list of required documents that are needed for by report billing are available in the provider manual, which are linked on this slide. I do want to highlight here, and it's important to note that once the Medi-Cal fee-for-service reimbursement rates are established and effectuated into the system, all claims that were previously paid by a report back to July 1st of this year will be automatically reprocessed at the final Medi-Cal fee-for-service reimbursement rates, which could result in some claims being adjusted and either supplemental payments or some form of recoupment, again, depending on the final Medi-Cal fee-for-service reimbursement rates that are ultimately approved by CMS. Next slide, please. So next, we're going to focus a little bit on the billing policy for BHT services. So just a couple of important notes here. Enrolling through our provider enrollment system is not intended to impact the negotiated and agreed upon rates that providers currently have through whatever contractual arrangements they have with individual managed care plans. And so again, those final Medi-Cal fee-for-service reimbursement rates will only be applied to those claims being paid directly by the department. Next slide, please. So this slide and the next two slides contain the billing codes and descriptions for BHT services that are covered under our Medi-Cal policy. I'm going to go over them quickly, but I would encourage you to take your time and re-review these codes and descriptions at your leisure. There are approximately 17 dedicated billing codes that are included in the provider manual for BHT services. These codes were selected in partnership with our advocates. I just want to note here that there may be other services that are related or incidental to BHT services, but those are not included as part of the BHT policy in the manual. Those may be found in, for example, the non-specialty mental health policy or other policy areas. And so those coverage policies would control in that space, and that would be what you would look to for billing because it would be outside of the BHT coverage and billing policy. Next slide, please. And again, this is just another slide. It's a continuation of those approximately 17 dedicated BHT billing codes that I mentioned. Next slide, please. And this is the final set of billing codes associated with BHT services, which again, you can find outlined in the Medi-Cal Provider Manual. Next slide, please. So as I already mentioned, we will be paying for BHT services using the billing codes from the last three slides. These will be reimbursed at the Medi-Cal fee-for-service reimbursement rate, which will be approved by our federal partners at CMS. Couple things I want to note here. So we will reimburse for BHT services provided by all three levels of the QAS practitioners at the exact same reimbursement rates. And again, as I mentioned, the final Medi-Cal fee-for-service reimbursement rates, once approved by CMS, will be posted to our Medi-Cal rates page. Next slide, please. So given that we've covered a lot of information in today's presentation, there's bound to be questions. So we have put together some helpful resources for our members, for our providers, and other stakeholders to review. Next slide, please. So on this slide, you will find that list of helpful resources which we've compiled for your convenience. Again, I would encourage you to review all of them at your leisure, as I think they would be helpful in understanding our refined policy approach in this space. Here to also note that we have recently updated our dedicated BHT webpage, including a brand new frequently asked questions document. We will also be using the BHT webpage as our main source for materials and updates regarding BHT services. Next slide, please. All right, so with that, that's the end of my pre-recorded presentation for today. Now we're going to pivot and do a quick Q&A session for some questions that we've received from our stakeholder partners.
Hey, Erica. Do children need to have autism to receive BHT?
Thanks, Raquel. So excellent question. So no, BHT services are available to any Medi-Cal child under the age of 21 for whom a doctor or psychologist determines that the services are medically necessary. And again, the medical necessity determination is using that EPSDT standard of whether the services will correct or ameliorate, other words, make more tolerable any condition that the child may have.
Thank you. And how long may a child receive BHT services?
So once a physician or psychologist has determined that BHT services are medically necessary, the child's entitled to receive BHT services under their approved treatment plan as long as the treating QAS provider determines they are medically necessary up and until the point the child turns age 21.
Are BHT services available after the child turns 21?
Excellent question. We get this one a lot. So Medi-Cal's authority to cover BHT services is limited to children under age 21. Although I would note that Medi-Cal members ages 21 and older may receive other services and supports under a non-specialty mental health benefit, occupational therapy, speech therapy, and physical therapy, as well as a number of other medically necessary services and supports that are covered under the Medi-Cal program.
Is there a limit on how many hours a week a child may receive BHT services?
So the answer is no. The number of hours that a week that a child may receive BHT services are ultimately determined by the treatment plan that's developed by the QAS provider. I would just note here that treatment plans are subject to utilization management controls, which can include prior authorization requirements.
Does Medi-Cal require parent guardian participation for BHT services?
No. So, a Medi-Cal member cannot be denied access to BHT services for lack of parent participation. However, BHT services can include optional parent guardian training when it's part of the treatment plan. And again, I just want to highlight here that the department recognizes the value add in having parents participate in BHT services.
Who is responsible for providing BHT services if the child has private insurance and Medi-Cal?
Sure. So, as with all other Medi-Cal covered services, Medi-Cal's other healthcare coverage policy is clear that Medi-Cal is the payer of last resort. So, if children with dual healthcare coverage are able to receive BHT services from the other payer, so like for example, their private insurance, then the private insurer would be the primary payer and Medi-Cal would then wrap around those services and be the secondary payer for anything that wouldn't be covered by the private insurance.
And what are the timelines for Medi-Cal children to be assessed for BHT services?
Sure. So, for Medi-Cal managed care plans, they must provide BHT services in the same manner as timely access standards for all other covered services. I would just note that there's no specified timelines in Medi-Cal fee-for-service for when a local regional center or an enrolled QAS provider must conduct an assessment for BHT services.
Are children placed in foster care settings eligible for BHT services?
Yeah, so foster children or youth, or former foster children or youth under the age of 21 uh, who have Medi-Cal eligibility can receive BHT services, again, when determined to be medically necessary by a physician or psychologist.
How would a QAS provider enroll who employs QAS professionals and QAS paraprofessionals?
Sure. So, QAS provider organizations, as I mentioned, they're not going to enroll as groups, but they're going to enroll as a healthcare business. When beginning your Medi-Cal provider enrollment application, you would select the I am a healthcare business option. You wouldn't select the options for group or mixed group. The QAS provider organization would then report information about the QAS providers, QAS professionals, and QAS paraprofessionals for whom they are planning to bill on behalf of for BHT services within the healthcare business application. BCBAs will not submit separate applications and will not individually enroll.
And how would a QAS provider or CBO report their BHT providers to DHCS? Can they submit staff and changes to their staffing by submitting names in an Excel document?
Yeah, so QAS providers and CBOs will need to enter all of their QAS providers, professionals, and paraprofessionals in the Medi-Cal enrollment portal. By state regulation, changes must be reported to the department within 35 days, and they must be entered in that same enrollment portal. Unfortunately, the department is not able to accept changes through the submission of like an Excel document or any other type of document. Again, it has to go through that enrollment portal.
Do I need a national provider identifier or NPI number to enroll?
Yes, all enrolled billing and rendering providers need a national provider identifier or NPI number. You can register for an NPI online simply by doing an internet search for NPI and then clicking the result that says it's MP NPPES NPI registry. You can also find a link on the DHCS BHT webpage on the BHT FAQs for provider enrollment document. Okay. I think those are all the questions that we had for today's presentation. I very much appreciate everyone's time and attention today. So this concludes today's pre-recorded webinar, and I hope you all have a very nice rest of your day. Thank you.